Dr. Exman, thanks for joining me here because we want to talk about sleep apnea. Now, this is an important issue and one that impacts millions and has been known to kill. So where do we start?
Well, let's first kind of describe maybe what sleep apnea is. Okay. And one of the things that we know is that as we start to fall asleep, we start to lose muscle tone. And when we get into REM sleep, we lose all muscle tone at that point. So that's where we see kind of this thing start to happen, is that during REM sleep, we start to lose this muscle tone and we start to snore, and it can eventually lead to sleep apnea. And again, this leads to, importantly, loss of oxygen. As we are not breathing, we lose this oxygen, and this can actually happen for a minute and a half in some of our patients and happen 500 or 600 times a night. And as we put our stress on that heart, because of that lack of oxygen for long periods of time, that can actually lead to a heart attack in our sleep.
Now, let me show you something that I found on YouTube. I'm going to pull it up on my phone here, but we'll show it on screen too, because I think this will illustrate sleep apnea at its worst. So as we go along here, so we hear the snore. So tell us what's going on here.
So again, what we notice is that classic sign of that sleep apnea, and that's that snoring sound.
Right.
And in fact, snoring may in itself be benign and not cause a problem. But in this case, we can see this individual, the snoring suddenly becomes a little bit louder, a little bit louder, and a little bit louder. And we see the first apneic event happen for this. So you can kind of count with me to see how long this happens. And if you think about it, if you would ask this individual, can you really hold your breath for this amount of time? A lot of the people can. But suddenly we see that this individual, suddenly just starts to gasp for air, and he's starting to break the apnea. But remember, he has to wake up for this to happen. So we've had this first awakening after this period of time of not breathing. And again, if we listen again, he immediately starts to not breathe again. So he's fallen back asleep, so he can get a little bit about it asleep. And now we start counting again, and we can see how long this takes. Time after time goes by. And again, this is so hard on his heart. And that's where we have the issue. Not only is it hard on the heart, it's hard on the body as well, because we're just not getting the sleep we need.
So what causes this? What causes sleep apnea?
Well, there's two different types of sleep apnea. There's obstructive sleep apnea like you just saw, where it's just narrowing of the airways. Then there's what they call central sleep apnea, where we just don't breathe for one reason. And a lot of times we know that in young children as known as sudden infant death syndrome. So in this case, we're probably looking more at obstructive sleep apnea. And a lot of times it can be caused, one, again, as we go into REM sleep, lose that muscle tone. It could be the jaw structure that causes a narrow airway. That if we have a jaw that juts out, we have a larger opening. If it juts in, we don't do as well. And as we put on a little bit more weight, that causes fat to lay down throat, that narrows the airway. But also, just as we age, men, we lose muscle tone. And for females, once they go through menopause, they're at a higher risk of having obstructive sleep apnea again.
So now on a retail floor, what might we hear from our customers that may indicate that they have sleep apnea? And if so, what do we do? Because this is pretty scary stuff. This is like doctor stuff here.
It really is.
So what do we do as salespeople?
But not only as salespeople, but educators is what I like to think of at this point. You get an opportunity to educate someone. When they say something like, and they'll probably make a joke about it, man, my partner brings the house down snoring.
I got you.
Or maybe they may hear something like, boy, and every once in a while he just quits altogether. But it's usually, it's a loud indication that it's just this obnoxious amount of noise driving me in the other room. And they may stop breathing at that point. So it's that point you need to recommend, listen, if you hear them stopping breathing for long periods of time at night, you need to go see a doctor, because not only does this lead to sleep loss, it also leads to hypertension, heart disease, and a possible heart attack. You need to see a doctor for this.
Now, just to be clear, does everybody who snore have sleep apnea?
No. Snoring in itself is benign, unless it's your partner, because you're snoring even though it isn't sleep apnea, may be causing your partner to have disrupted sleep. Get even mild to moderate snoring, get it solved, because we want to stay in bed with our partners.
So what can we do? What can we suggest to our customers if we do identify that they have sleep apnea?
Well, again, if they have pretty severe sleep apnea, it's probably going to be a CPAP that we're going to probably, but again, that's going to be a doctor prescribed device to do that. But beyond the CPAP, beyond sending that, if we're just having mild to moderate snoring or even mild to moderate sleep apnea, there are some little little devices that we can do. There's some little dental guards that literally just pull that jaw forward a little bit, and it'll open that airway up some. That you can buy them on the internet. They're very, very effective. They're approved in the U.S. by the FDA. They work very well. There's other cases where you can get surgery done. They do laser surgery in the back of the throat to do it. They do surgery to remove some of the soft tissue in the back of the throat. So there's a lot of things that we can do, even positional devices. And for some people, even just a motion-based by raising the head of the bed up just a little bit and the proper pillow will allow them to sleep better, and just getting them up on their side to sleep.
Now, this is a very serious issue, and it's impacting many of our customers. So thanks, Doc. This helps us be better sleep consultants.